roto I te iriri kapua kua api ia te au dental therapist kia nā roto I te tātai po api te rawe mai te tuang hoi o kia Dr. Sima. Te api te au tuanga kia maramarato I te au prokaramu te kariro I tauturu e akamaruru I rato I te rawe ngai te anganga ki I te akonoanga I te nio tātātou anō tamariki. Me te tuatau mai I te au clinic paunu ere, te ero mai ki te tuatau ere I te anō tamariki te api. No reira, ko te au tuanga ne, au tuanga pōpinga te reira, kia maramarato, no te nio tātātou, no te oranga o tātātou anō tamariki me te tuatau mai anō te porokaramu ko te baby teeth matches, kia raukai tātātou anō tamariki te oranga me take te watu ki te teitau o sini rā I roto I tō rātou oranga. No reira ko te tamatu iriri kapua I rawe I te tuatau ne.
Kia ora tātou kātou tō. Kia ora. Ane te ana tikana te tua. Taki rurua kera rātou I te ngai o kotai. Ma te naoro o kotai. They all gathered together with one accord. Healthy Islands 2030 Plus towards a cavity-free future for the children. We have refocused our preventative work focusing on children. Where we are today in terms of the ancillary conditions of our people. For that reason, we developed the National Health Reorientation Plan 2024 Plus. But in here it sets out the delivery outcomes, what is expected of TMO between now and 2030 and 2030 going forward. Hence the theme of your training this week. So one of the delivery outcomes in our reorientation plan, maternal health and oral health integrated policy developed and integrated with oral health, primary care and public health. So this is one of the delivery outcomes where Dr. Danny and all the team and all of you has to put this in place, and from 2030 and beyond, we're looking at a cavity-free future. It's not going to be easy. So we've set these delivery outcomes, not really for us today, but most importantly, and also the expected outcome by 2030 plus. It says improved natural teeth retention. So from the STEP survey 2022, the baseline sitting at 78.3%, the retention of natural teeth. 78.3%. So what we are trying to achieve is to increase that. We did not set what the target is between now and 2030, but I'm hoping that by 2030 we'll increase it to 80%. And by after 2030, the aim is to get to 100%. That is the cavity-free future that are doing on them. So I wish you all the best. We wish you all the best from the executive, the staff. Enjoy your training. It's a week, and it gives me a great pleasure to officially open your training.
It is good to see you guys here this morning, and I welcome you all to this training. It's been a task put together for a while, and we are grateful for the effort that has been put in, Dr. Sima and the team. So for me, it's basically asking some questions. Okay? Ask yourself, what are you here for? What do you want to gain from this training? Because at the end of the day, it's what you put out there in the community that's going to make the difference. Okay, it's nice to come here, fly the plane, spend a week here in Raro, do some shopping and go back. But what we want is to see how our work gonna advance into the future.
2 years, 3 years back, there was a team that traveled to the outlands, mainly to look at the healthy living. And one of the main points there was the oral health, the status of the oral health in our young children. Their finding was very high. The caries in our young children was very high. Now they are bringing us back here to have a look and see how are we going to help out with our children and also the mothers, especially the ages from 0 to 3 years. Those are the main ages, and also the 4 years and older. So in this workshop, actually, Prism helps us a lot on how dealing or treating our young ones, and also giving the help that the parents or guardians wanted, not only for us therapists, doctors to give our help, but also for the parents and the caregivers at home to do their own part, so that maybe in the next 5 years' time, then the Cook Islands will become as a caries-free country in our infants and also our children. So this is the main reason. That's why we are brought here in Rarotonga to look at this and how we're going to deal with it and how we're going to help out in the future. Thank you.
Okay. Kia ora and good morning. My name is Tupai Ruarikinga Tokana, or known to many as Sparky. I am a dental therapist from the island of Aitutaki, and in this workshop, I have gained new and a lot of knowledge that will help me improve the quality of services in the oral health department upon my return to Aitutaki. Thank you.
Kia ora, my name is Ahmed Suakla Soromwekafiti. I'm an oral health therapist living here on Rarotonga. I graduated from Auckland University back in 2022. This training is it's kind of like a refresher course for myself, and it's good to learn and experience or exchange knowledges from my other colleagues, because some of us are locally trained here in Rarotonga and some have trained overseas. So learning from them, sharing their challenges and how they overcame with it is interesting to know.
My name is Tai, also known as Mama Nio. I'm the dental therapist for Mangaia. The past 3 years I was working in Maniki and Rakaanga, and this year, for another 3 years, I will be based in Mangaia. What I gained from this workshop is how am I going to work along with the parents and also our children from 0 to 4 years old. I thank the Ministry of Health for bringing me along to Rarotonga, and also I would like to thank our lecturer, our specialist, Dr. Sima, for thinking of us, the Pāinua, and also the knowledge she's giving to us.
Tōku ingoa ko Pito Tamata no Achi mai au, no toi te tōnga te pārungia, te marae ora. Me mua te raukanea ki te kameta ki te tōnga iriri kāpua, i ora ia mai kia mātou no te Pāinua. Nō te mea, ka riro te i te tauturu ia mātou, i te tauturuanga i tō tātou i te tangata. I roto tikai i tā tātou ānau tamariki, me te ānau anga te pepe i te rima mataiti. E ko te tai au tonga, kua rira te rira i te tauturu ia mātou, i te āwhanoanga i te terenga i tā tātou mitsua, e pēra te au pepe i te āwhanoanga i tō rātou mio, i roto i te tonga o te mio tamariki. Ko te mea, ko te tai aramataiti pōpinga tea, ki āwhanoanga te mio i tā tātou tamariki, e ko tā mātou i e umumu nei, a te au tātou ki mua, kāre lawa e niope e kitea i roto i te ia ārea mataiti.
So, kia ora ana tātou katoa. So the content of the capacity building workshop is aligned to the scope of practice, duties and responsibilities of our dental therapists in terms of strategic and operational excellence, patient care, information management and reporting, as well as teamwork. So I believe the workshop not only enhanced the performance of our staff in terms of their practice, but also achieved key results areas and contributed to the overall success of the oral health service key results area in the Ministry National Plan. So thank you to all our sponsors, and hopefully we have more training such as this in the future. Mei taki.